Jordan. How's it going?
It's going fine. How are you?
Good, thank you. I'm so sorry your camera is not working today on your laptop. Okay, well, no problem. We can still do a little interview here. Jordan, are you the PCNSL patient or care partner?
Yes, I am the PCNS.
Okay, thank you. You're the patient, correct?
Yes.
Okay, Jordan, thanks. I'm Dellann. I'm with the End Brain Cancer Initiative. That's who you're talking to. So, I just have a couple of questions for you today. So, how are you doing?
I'm doing great. Just well, will I say great? Just being positive, but I'm okay.
Okay. Oh, okay. You're thinking positive, though, it sounds like. I think I heard you say
Yeah.
that. Great. Awesome. Let's see. I want to know from you, and you can answer this any way you want, okay? So, if you were able to speak about when you were diagnosed, can you tell us a little bit about your story? What happened?
Yeah, I've been diagnosed since I was a toddler. So
Since you were little. Since you were little.
yeah, yes,
Really?
I've been living with this for a long time.
Oh my
Um,
gosh. Do you
um
know how old you were?
yeah, I was about 3, 4, I think.
Wow, okay. Goodness gracious.
Yeah,
That's
yeah, my parents noticed that I had delayed speech. I had poor motor development as well. I also, lacked some social engagement. So,
uh-huh. Uh-huh. That makes sense, right? That makes total sense.
yeah,
So, gosh. So, how old are you now?
so I'm 21.
Oh, you're 21. Okay. Okay. All right. Good. Well, good. So, what I wanted to ask you is what do you wish when you were diagnosed your healthcare provider had told you or shared with you about your diagnosis, your PCNSL diagnosis?
That would have been my parents, because they, you know, remember I was young, but I still, I interacted with the doctors many times, multiple times, so I can still answer that question.
Oh,
Uh,
thank you.
yeah, so I wish they had told me a lot. I wish they had told me how this, you know, could affect my life. My parents did not tell me that it was, permanent or there's no cure. So I thought that, someday this will stop, I'll grow out of it. So, yeah.
Okay. Okay. So you wish that your healthcare provider had told you how it would affect your life when you were
Yes.
diagnosed. Okay. Okay.
Yeah.
And then you learned about it as you got older, probably because you
Yeah, I learned about it. I learned about it. A lot of support. I also prepared for the future. I also focused on the now as well because yeah, it might not be going and I wish there's like a cure, a part cure for this. So
right. So you're focused on the here today, right?
yeah.
Good job. Good job. Um, so is there anything else that you would have wished that your healthcare provider had told you or shared with you or given you?
Well, it didn't show me support communities or support like I would the only support I got was from the doctor and family. It didn't introduce me to other, set of,
Okay.
supports that I could go to. I had to
Mhm.
figure out that on my own. Also, the treatments available, I only knew some speech therapy, occupational therapy, some physical therapy. That's what I only knew, but I was not told about any, some, treatments or permanent treatments. I guess there's no even cure for it. So,
Right.
uh,
Right.
I wasn't not told that I am being monitored because I needed to be monitored because yeah, I was, told that, I would be watched for any regression or sudden changes, especially, during my puberty. I guess that's why I was seeing the doctor often while I was growing up. So
That makes sense. That makes sense. Thank you. Thank you. Let's see. Can I clarify something that you said? I wasn't sure if you had received, physical therapy and occupational therapy. Did you receive like speech therapy?
Yeah, I did receive like speech therapy.
So you received the all those therapies.
Not all about the main one I did or I engaged in was speech therapy.
Okay. Okay. So you did receive speech therapy. Were you saying you wish,
And
were you
yeah,
saying,
I wish that,
I wanted to clarify, were you wishing you had received other kinds of therapy, such as occupational therapy and
yeah,
physical therapy?
yes, yes.
Okay. Can you say that clearly?
Yeah, yeah, I wish that I would have received that earlier. I wish I would have received it because it was only based on speech therapy. I actually didn't know about other therapies that could help. I
So,
wish that I was told about different therapy or different treatments.
okay.
Also, one more thing that I wish the doctor told me was about genetics and it being passed down to my future children. I was probably because of I was young, so I mean, he didn't tell me that, but like, from the internet sources, I found out that that there are chances that it could be passed down to children, or because it's a genetic thing.
Okay. And can be passed down to children. Okay, that's a very, very important point. I hear you. Okay, thank you for sharing, Jordan. So you couple of things. You wish you had been told early on about speech therapy, physical therapy, occupational therapy, things like that, right?
Yeah,
Okay. And you also wish that you had been told that PCNSL is a genetic disease and it can be passed down to one's children, correct?
yes,
Okay, all right. Thank you. I heard you. Okay, so my last question is, if you were talking to the what we call the pharma industry, so that's the companies that are doing the research on PCNSL and they're trying to come up with an effective treatment for this disease. If you were to say anything to them, or what is it you wish they knew, what would you want to tell them or share with them?
I wish they knew what it means to have this illness. I wish they could understand the condition and how it affects lives. I also, want them to understand what it's like to live with it. Then I also want them to know to really focus on different, type of treatments like tablets, or how do I put it? Oral treatment, injector treatment as well. Different, channels of treatment. Let it be versatile and flexible, very easy to use as well. Let it be also easy to adapt, and let it not cause any life changes, because there's some treatment that you have to change what you're doing or stop what you're doing. It's going to be very stressful. Also, make it as very effective, and let it be very tested before it's brought out to patients to try.
Right, right, exactly, exactly. I hear you. I hear you. So, okay. So if you were talking to industry, the companies that are researching PCNSL and trying to find an effective treatment for this disease, you say you would want them to further understand from a patient perspective what it means and what it's like to have this disease, right?
Yes.
Okay. You also would like them to know and know about focus on oral treatments, correct?
Yeah.
Okay. And you also would want them to understand that this is a stressful disease. So anything they can do to minimize that stress would be very, very helpful to the patient.
Yeah.
Okay, correct. Great. Is there anything you want to say differently or rephrase or say it stronger? Now's the opportunity.
Well, yeah, I would want them to target the most important thing. I would want them to actually like focus on the cure symptoms, like, that actually affect our daily lives. and I want them to target. I would love them to make this treatment target the main symptoms like speech, communication, behavioral regulations. Even some have seizures. I think some have sleep problems as well. I would want them to focus on those symptoms.
Okay. Okay. Thank you so much, Jordan. That was really good and really good information. I really appreciate that. You just sharing what you just shared will help a lot of people down the
Yeah.
road, because I know that not only are patient advocacy organizations such as the In Brain Cancer Initiative, working really, really hard on behalf of patients like yourself, but I also know that industry, there are companies really focused on PCNSL, and they will learn a lot from what you just said. So thank you so very, very much. Happy Friday.
I have a nice day.
Okay, ciao. Bye-bye.